Hello everyone, how are you all? Hope everyone is doing good. So today let's study about current principles in pediatric nursing. Before coming to the principles, let's see the meaning of pediatric. You all know that it is derived from the Greek words, and pedia means child, iatric means treatment. Okay. So the principles, there are basically 6 principles in that, and some others are there at last. For the exam you can just add some more points. Okay, so the first point is respect the child's need to regress and help him to accept dependence on others if he resists this. So regress is nothing but less developed state. So if the child is in less developed state, we should help the child to accept his dependence on others. Like if he can't do anything on his own, we should help him to accept that he should depend on others. Alright. And the second point is have an awareness of the child's need for help in reconquering the negative counterpart of the core problem in the stages of development to which he has regressed. So we should have, or we should concern about the child's need. Alright, so if during the less developed state, we should be concerned, or we should have consciousness of the child need. Whatever help we can do for the child, we should be conscious about it. And whenever the problems are there, maybe in the center part, or so many problems will be there in the middle, but for the stages of development, for that we should help, or we should be concerned for that, and we should help the child to overcome it. That's the main thing. Alright. And the third one is protect the child's family interrelationships, IPR, interpersonal relationship, and interrelationships with the child. So child and family, it's really important. Do you know why? Yes, so for the child and family there is a bond between them. So if everything, the basic foundation comes from the family only, right? So protect the child's family interrelationship. So this is the main principle. And the fourth one is awareness of the feeling of others and readiness to respond to them so as to strengthen their resources to cope up with stress is the major principle underlying effective emotional support. So we should be concerned of the feelings of others. Okay, so whatever it's going to happen, they will be fully prepared for that. Alright. But still we have to be concerned, or we have to be aware of the feelings of others. This is the main principle in effective emotional support. So this we can call it as mentally stable. Alright, so this is the main thing. And the fifth one is children can tolerate discomfort if they are prepared for it. Complement its real purpose and are adequately prepared. So whatever happens to the children, they will accept it. They are ready to go for it, but they will understand the real reason or real purpose, and they will be getting prepared into it. Alright, so the children are really strong for that. That's what the last principle said. We need to give emotionally support, effective emotionally support. So children can be a good persons. Children can deal everything. They are good. And the last one is child play is not time out from daily living, but rather an essential part of it that enables him grow and mature through the various stages of development. So it's a common thing, right? If the child is playing, it's not only for the daily living, right? It is a very essential for his growth and development through the various stages of the development. So we know for 0 to 2 years he will be, if he is playing or not also, it affects for his growth and development, right? So like that, for the children, for adolescents, and for the preschoolers, we see different stages, but it has its own various developmental, right? We can see development, so they are getting grow and matured into that. So not only play for the daily living, but it's really essential them too, like part of that enables him to grow and mature. So in each way, like we see for the children, some mothers make them to do so that their thinking capacity, growth, maturity, it will grow. But some others, what they are doing, they will just help them out, not only helping, maybe for the example, for doing the homework, the parents or their friends will be doing, he's not working into it. How? Right, their thinking capacity is less. So like that, for the growth and mature through the various stages of development, it's really essential part, and it's really important. So these are the 6 principles, and some others also we can just see. Build a working relationship with parents and their children from time of first contact. Should be aware that all behaviors should be meaningful. Should accept parents and their children exactly as they are. Allow them to know that their problems are important and the nurse is there to aid in their solutions. Have an empathy for parents and children, willing to acknowledge the parents' right to their own decisions concerning their accident. Allows the parents and the children to express their emotions, even negative emotions. Ask questions limited to a single idea or reference. Speak a language understandable to the parent and children. Must help the parents to feel that there is unity among the health team. These are the some other points like a nurse should do, or nurse should give the health education. Nurse can give the health education as after the delivery of baby, and for the preterm and for postterm, the nurses used to give the health education, right? So like that, we can just educate the parents, because parents also play an important role in this. So these were the 6 points. I hope everyone understood it. If you have any doubt, let me know it. Thank you for watching. Have a nice day.